Hello, and good day to you. I'm Dr. Richard Ricciardi, Professor, George Washington University, and Executive Director for the Center for Health Policy and Media Engagement. Each year, the George Washington Center for Health Policy and Media Engagement selects a cohort of health policy and media fellows. I am proud to share with you in this video comments from 4 fellows who recently completed their fellowship. The 4 fellows will share highlights from the noteworthy scholarly work that transpired during their fellowship and what participating as a fellow has meant to them both professionally and personally. Thank you and enjoy.
Being part of the fellowship has really helped to provide the scaffolding for me to engage with our media teams, to have a voice in my internal organization, as well as to learn how to pitch stories externally and really highlight and elevate the voice of nurses within my organization and nationally. Through that work with my marketing and media team, I've been able to pitch multiple stories to our local media, both print and video media. I've been able to participate in podcasts, which is something I did not ever do before and didn't anticipate I would do. And I've been able to work with a lot of different marketing and media experts and receive that really expert advice and guidance.
¿Qué valoro? ¿Qué me llevo de esta estancia? Lo que más valoro de esta estancia es haber conocido y haber trabajado mano a mano con mi mentor Richard Ricciardi. Él, desde su experiencia como enfermero y como miembro de juntas directivas en las que ha estado como profesor universitario, me ha ayudado a perfilar muy bien el proyecto en el que estamos trabajando. Ha reforzado durante estos meses mi confianza en que investigar sobre la competencia comunicativa y política de las enfermeras hará avanzar esta profesión y los cuidados de los pacientes.
This fellowship has meant so much to me. I'm very grateful for the opportunity to work with the leaders in media and health policy at GWU. My mentor, Dr. Melissa Batchelor, she's a podcast powerhouse. She's helped guide me with dissemination of my topics, has shown me how to build a consistent audience.
It has been sacred time to focus on my scholarship and my own creative academic development. I've really appreciated the chance to meet with such a dynamic group of people. I'm motivated by their energy and the projects they have going on and appreciate so much the impact their thoughts and opinions and support has been for my own academic path.
El segundo aspecto que más valoro es el haber tenido la oportunidad de conocer al resto de las enfermeras becadas. Ver cómo ellas han ido desarrollando sus proyectos, lo que ha inspirado en mí es ser consciente de que eso mismo que es un reto hoy en Estados Unidos puede serlo en un futuro en España o en Latinoamérica. Y conociendo sus experiencias y sus proyectos podré desarrollarlos también en mi país o en países latinoamericanos.
Before being part of this fellowship, I never even had the thought of pitching a story for a podcast or, pitching an idea to a group of individuals for an op-ed. So really by participating, it's given me that almost that authority that I can do this work and I should be doing this work.
This fellowship has also helped me personally as I've made new friends who are also fellows from all over the country. And I'm certain that we will stay in touch and collaborate in the future.
Another thing this project has meant for me has been the value of having my mentor invest in me and be so engaged in my success and what I wanted to learn. Time after time, when I met with Dr. Pulcini, she has had the exact article to refer me to or the connection to help me have a conversation with someone that was what I really needed to move my ideas forward. So I'm very appreciative for that.
Even, when I do my presentations externally and I can say, I'm a fellow at the GW Center for Health Policy and Media Engagement, it carries a certain amount of weight. And I think that makes people kind of like, oh, okay, all right. She has a title that helps us to recognize her and listen to her. So thank you guys for providing this.
Si yo recomendaría esta beca, sin ninguna duda, sobre todo ¿para quién? Para aquellas enfermeras que creáis que los conocimientos que vosotras tenéis de vuestros pacientes, de las familias, de la sociedad en la que trabajáis, deben ser difundidas por los medios de comunicación y ser tenidos en cuenta por parte de quienes toman las decisiones en salud política. ¿Esta beca qué os va a aportar? Herramientas para que esa evidencia de la disciplina enfermera sea conocida y considerada valiosa por parte de los periodistas y de los políticos. Todas las que tengáis la oportunidad de ser becadas por el Center for Health Policy and Media Engagement, acabaréis suscribiendo una frase que resume muy bien todo lo que yo he aprendido durante estos años. Comunicar también es cuidar.
You know, I've also grown professionally through this fellowship, and I'm discovering that there's more than one way to disseminate information, not only to other professionals, but to the general public as well. You know, my guests are also able to disseminate their research through my podcast. Having one's research published in a professional journal is still a preferred method of publishing, but being able to talk about your research on a podcast is gaining traction.
For other nurses who are considering engaging in this fellowship or taking a greater role in reaching out to media or using alternative methods to advocate for patients and families, I just want to emphasize that it is absolutely the role of a nurse. It's within our wheelhouse, and we're uniquely positioned to do this work. So just hope that I can be an encouragement for other nurses to continue this work, engage in the fellowship, and really use our voices to advocate for our most vulnerable patients and families.